Hey ladies, I just wanted to take a minute today and talk about one of the most frustrating things that I hear when clients come in for the first time. And so many of them have been suffering for so long and they didn't know where to turn, and they've often been bounced around from provider to provider, or trying this medication or that medication, or having to go for this test or that test, which might be necessary, but also prolongs their suffering. And so I really have a passion to educate and help us understand our own bodies so that we might at least be able to advocate for ourselves better and might be able to have a better understanding of what we need and how to help ourselves some before we end up down those rabbit holes, or God bless Dr. Google. Hi, you guys. I'm Amy Van Der Linden, Pelvic Floor Physical Therapist at Moment of Truth Physical Therapy, and I'm here today to talk about your pelvic floor muscles and just break down some of the mystery and help you understand your own anatomy so that hopefully you can find some of your own solutions a lot sooner, or have direction of who to seek out if you're needing assistance or have any ongoing struggles or issues. You have 3 layers of pelvic floor musculature for women. There's the perineum and that external layer. That's the band that goes between the vaginal and rectal openings. We also have the layers that are in the vaginal canal, layers 1 and 2. And so there's kind of that external, there's a middle, and then there's a deeper layer. And that deeper layer functions like a hammock that goes from our sacrum and tailbone around to our sit bones out here, and then around the front to the pubic bone. And so I don't want to bore you with all the different technical names and things. You can Google that. But I wanted to help you understand, because when we have a shoulder injury or a quad injury, I think we are much more apt to understand what it needs and how to address an imbalance or pain or inflammation or something. And none of us are taught that we have muscles inside the pelvis. We may know about like our glutes or sometimes our deep hip flexors in the abdomen, but very few of us are ever really taught about or understand that those muscles can be injured, have inflammation, have pain, have imbalances where there might be tightness versus weakness. And so especially as we age or with childbirth, so many of my clients feel like things must be sagging or stretched out, when in reality, a lot of pieces are still tight or inflamed or haven't been able to really complete that healing process. And so we're going to get into another video where we talk about some specific problems and some specific solutions. But I just want to start with understanding that you have muscle down there and that it can be injured and dysfunctional just like your shoulder or your leg, and take some of that mystery out so you can hopefully get some help and not suffer so long.